So today, let's talk about 5 fundamental and crucial things that people miss when they're trying to recover from sciatica. Whether it keeps coming back or they get better or only 50% better or whatever it may be. But the reason why you're having lingering symptoms or repeated sciatica is because you're not doing these things. These are the things that 95% of people are not taking the time to explain to you in a way that you understand, to help you understand your symptoms so you can start recovering. These are not traditional exercises. They're not traditional stretches. It's not like you're missing the perfect stretch. You're missing what your body is telling you. We're gonna go over 5 fundamental things, and I know at least 4 of these 5 you haven't heard of before. So hang with me. If you're wanting to get better and stay better and get out of this cycle of pain and not being able to do what you want and having this confusion, you're gonna wanna listen to these 5 things. It's what's made the difference over the past 10 years of treating people with sciatica. Let's have some fun along the way, take some notes, ask some questions underneath the video, but before I waste any more of your time, let's get to those 5 things right now. Okay, so you're here because you know you have sciatica, but what most people don't ask themselves is what's causing my sciatica? Well, in order to figure that out, you have to think of sciatica kind of falls into 2 different buckets. We're talking disc herniations or stenosis. One's due to the disc, one's due to bony changes in your back. And so most people fall in those 2 buckets. Now there are some other things that I talk about in my book and other videos that I've covered, but when you dial in sciatica and trying to figure out the exact cause, you usually fall in those 1 or 2 buckets, disc issues or bone issues, okay? So we're gonna go over how to tell which one you are in. Do you more likely align with disc issues or bony changes in your spine? Because the reason why I ask, those things are treated very differently. And what happens in the clinic when I treat my patients is that if you have disc issues and we treat you like you have bony issues, you don't get better. And the other way around. They require very different treatments, even though they have very similar symptoms. So let's go over which bucket you fall in. Okay, so let's talk about disc issues first. So disc issues. If you more likely align with disc issues, you're going to have a serious event or potentially a serious event that causes your symptoms. What I typically hear is people are bending over, lifting, twisting, and they go to do something, pick up their kid, pick up a box, and they suddenly have back pain. And then a few days later, they start to develop nerve pain down their leg, et cetera, et cetera. So there was some particular event. You're usually around 40 years old, give or take, plus or minus 10 years. And then you typically will have worse symptoms when you go to bend over. So when you go to bend over and tie your shoe or bend over and pick up something from the ground, you can't do it. You're locked up, you have nerve pain down the leg, you just can't do it. And then sitting is absolutely the worst enemy. You don't want to sit. You feel better getting up and moving around. Those things more likely align with disc issues. Now, when we're talking about stenosis, bony changes, it's kind of the opposite. You typically are a little bit older. You don't necessarily have a particular event that caused your pain. It kind of gradually increased over time. You feel amazing when you sit and you feel awful when you walk. When you're standing and walking, it feels awful, but when you sit down, you almost immediately have relief. Where disc issues, you typically go to sit down and you're, especially in a soft chair, and you're like, get me out of here, I need to stand up and walk. Those are very different things. And then with stenosis too, you're more likely to have like a shopping cart sign where you can stand and walk as long as you want, as long as you're leaning onto something or using the shopping cart to take your body weight. You're like, hey, I can do this all day long as long as I have something to lean onto. Whereas if you go to try to stand straight up and walk on your own, it's very, very challenging. And so you think to yourself, do good self-reflection. Which one of those buckets do I fall in? Because that's gonna change how we treat it. The treatments are very different. Now in my book, I lay out 8 weeks of a treatment program for each of those and a couple more questions to help you further diagnose it. But those are the big things that we want to think about when we're thinking about stenosis or disc issues causing your sciatica. So the second thing is a little bit more obvious, but you wouldn't believe how many times people come to me and they think they have sciatica, but they truly don't have sciatica. So let's take a couple minutes here to review what sciatica really is. And so when we're talking about the treatment of sciatica, it's important to know that we're actually treating sciatica because a lot of the sciatica treatments revolve around improving nerve pain. Well, if your pain isn't coming from a nerve, they're not going to help at all. You're not going to have any change in your symptoms or any change in your relief if we're trying to treat a nerve, but you don't actually have nerve pain. So let's review for a second. The sciatica is pain that goes past the knee, burning kind of nerve type pain past the knee into the calf or foot, that you have some sort of abnormal sensation. It feels like spiders are crawling on you, or it feels like it's numb into your foot or your toe. And then you have weakness in your foot. And so that's a little bit hard to test on your own. But those things are what characterize sciatica. You notice what I did not say was lower back pain, because a lot of people think they have sciatica, but they actually just truly have glute or lower back pain. And we have to remember that there are a bajillion structures in your back, from facet joints to disc, like not from a herniation, but like a disc referral or muscular patterns or some sort of abnormal movement patterns or hip pain that refer into this area, but typically don't go past the knee. So if you're the person that is like, oh, my sciatica is bothering me, and you're pointing to here, it's most likely not sciatica. And maybe the reason why you're not getting better is because you're trying to treat it like sciatica, but it's truly not sciatica. And so sciatica is really characterized by pain or weird sensations or discomfort that go past the knee. That's because the sciatic nerve refers symptoms past the leg and past the knee. Typical lower back pain and glute issues do not. And so some of the times that I see people who they think they have sciatica, but they truly just have lower back pain, because lower back pain has a lot of referrals, and that's why it takes the good exam to figure it out. But here's what you can do. I'm going to go over a test really quick here that you can help figure out if you truly have sciatica or is it from your lower back. Let's go over that test right now. Okay, so this test is going to help you determine if you have sciatica or just generalized lower back pain that's referring down. And so remember, sciatica is from compression around the nerve. So it's either usually two things that happen there. One, you're walking more, and when you walk, you start to have symptoms that progressively go down the back of your leg and into your calf. That's one way to tell that you truly have sciatica, is that when you walk, and the longer you walk, the symptoms start traveling down your leg and into your calf or foot. That's sciatica. Now, another way to tell you have sciatica is actually by pulling on the nerve. And so remember, sciatica is a space issue around your nerve. Something's compressing on your nerve. We can do this test here to figure out, okay, is my nerve being compressed on? And what you're going to do is you're going to sit in a chair or on the edge of your bed or on a table like this. You're going to have the knees back. What you're going to do is you're going to kick out a foot, pull your toes back, and get in a really bad slouch position. If at any point in time in that test of this pulling back, slouch position, head down, your symptoms go whoop down the leg, or you feel that one side is extremely more tight or tighter than the other side. So let's say, for example, if I had more symptoms on my right when I did this compared to my left, and my right side is the side that I'm worried about, that could mean sciatica. So when I'm working with my patients, I'm like, okay, does this person have pain travel down their leg when they walk? Or and during this test, do they have reproduced symptoms? Is there pain going down their leg into their calf, their foot when they extend their leg, pull their toes back, and get in a really bad slouch position? If you said yes to those things, you have sciatica. Now, you can also take a test that I have on my website and ask you some questions, and those questions, kind of align with sciatica or not. And so that's kind of how you tell if your discomfort in your back is actually sciatica. Now, if you do those things and you have no change in the symptoms in your leg and don't have any symptoms, but your back and glutes are painful, your symptoms most likely are not coming from the sciatic nerve. So the third mistake here is when we're trying to treat sciatica and people are trying to do it on their own, or even if they've worked with somebody to try to treat it, they don't know when to push or when to pull their symptoms. And so what I mean is, when do we push forward and kind of, push through the discomfort a little bit, or when do we listen to our body and pull back? And so what I want to start off by covering is like acute or chronic. And so acute is early on. And so if you're within the last, 3 weeks or so of starting your symptoms, that's mostly a time where your body is like, hey, I probably should rest a little bit more than do. And if you get past that, then we need to start doing more, kind of move into that chronic stage greater than 10, 12 weeks or so. Then we need to know that we need to push forward, but how should that feel and what should you be looking for? So there's two things to consider. One is tissue irritability. And what tissue irritability is, and when we're talking the sciatic nerve, is how much can you do and how long do you pay for it? And so when we're trying to do an exercise, and I'm going to go over an example of this very soon, is that we're doing exercises and stretches, and we know that movement is the foundation to recovery for sciatica and disc issues. We know this, but how you do it is important. So when that comes in, is tissue irritability. And I describe this a lot more in my book, but in general, what it means is that how much can you do before you start paying for your symptoms? And so some people may only be one exercise and then they feel pretty good, but when they go on to the second exercise, they pay for it. They're sore for a full day. That shouldn't happen, right? What you should look for is how much can you do and only be sore for maybe, I don't know, 10, 15 minutes or so, and then your symptoms kind of resolve and they get better. So if you start off at a 3 out of 10 pain and you do some exercise, you end off at a 3 out of 10 pain, that's pretty good. But if you do the exercise, you start off at a 3, you end at a 4, but then you go up to a 5 or 6 or 7 and you hang out there for a day, that's too much. It's too irritable. It means you need to dial back the exercise and how much you do and how many reps and sets you're doing. On the other end of that, if you do the exercise and you're a 3 and then you go up to a 4 and you stay there for 15, 20 minutes and you go back down to a 3 or maybe even 2, that's a low irritability, which means that you can push forward. And so that first example, we pull back, actually doing less is more for your body. And in the second example, we kind of push forward and saying, okay, I was a little sore, but it's predictable, so I'm okay moving forward. Those are two very different things. And what makes sciatica tricky is because you're having symptoms down the leg or further down the thigh, is that you need to pay attention to tissue irritability and then also if you're centralizing or peripheralizing. And this is something that no one talks about, but in general, what it means is that if you do an exercise or some sort of movement and your symptoms are moving from your leg and going up your thigh and going up to the lower back, that's good. That's centralizing. So for example, and I'll do this soon, if I do an exercise in the first rep, no change in the leg, but then the second set or the second rep or so, it starts moving back up, that's a good thing. What some people experience is that, let's say they go to the knees to chest exercise for disc issues, which you shouldn't do that, but I'm giving this example because this happens, is that you do the exercise, you feel good in the moment, you do the exercise, and then your symptoms start going down the leg. That's going away from the body and into the periphery, which is what we call peripheralization, and at no point in time, 0 point in time in your recovery or any exercise or stretch that you're doing should you have any peripheralization of your symptoms. At no point should the symptoms move away from your back and go down your leg. Now what we do want is centralizing, and so the example of that being is that if it's moving up and towards your spine and glutes, we keep doing that exercise and move it up as far as we can. And I'm going to go over an example of doing that right now, but you need to know the difference between irritability and non-irritable, which means how much can you do and how long will you pay for it, and then peripheralization and centralization. And I want to go over a real life example of an exercise and what that looks like and feels like right now. Okay, so here's an example of tissue irritability and centralization versus peripheralization when you're treating sciatica. So let's do it. So let's do the bridge exercise. So this is a very common exercise for the treatment of sciatica, and honestly, it's just a very foundational exercise, but I'm just using this for an example. When you go to do the exercise, let's say I start off at a 3 out of 10 pain in my glutes and I have no pain down my leg. So I'm doing the exercise, I'm lifting, I'm feeling some muscles work, but then all of a sudden my symptoms start to go from my back or glute and travel down my hamstring. Remember, that's called peripheralization. And so when your symptoms are peripheralizing, that means stop. That means you are done with that exercise and you need to either do a stretch or wait until those symptoms go away. That is a hard stop if you start to peripheralize. Now let's say that same example, you have a 3 out of 10 in your back, you have some symptoms down your leg, and as you do the bridge or whatever exercise you choose, your symptoms start to reduce here, but go into your lower back instead. That's a good thing. That's centralization, okay? So as I'm doing this, I'm centralizing. And so I would keep doing it. So even though I'm having pain and discomfort in my back, but and the symptoms got better in my leg, but I'm still having pain here, I'm still gonna keep going. And so you can understand the importance of having somebody next to you or really dialing into this, and that you can understand the difference between centralizing or peripheralizing, and that if your symptoms are traveling down, that's bad, up is good. Now let's say in the same example here, I'm doing the bridge, I'm noticing some centralization here, but then when I'm done with the movement, my irritability and my symptoms really start to increase, and that things really start to throb down my leg. This is very rare. I don't see this happen a lot, but if that does happen, you need to change up your exercise. What I do see happening is that if you're doing the wrong exercise and you're not noticing the peripheralization, the irritability and your symptoms last a lot longer because you're not noticing that the symptoms are getting worse. And so to recap here, as you do the exercise and symptoms start to travel down, that's a hard stop because that is peripheralization and that's increasing the irritability. It means you're going to be sore for a longer period of time. If you do the exercise and symptoms start to creep up towards the glute or back, no matter how painful the back is, if your symptoms are getting better down your leg, that's centralization, and that reduces irritability. And so when you centralize, you're able to do more for longer. And so that's a good example of how to listen to your body during an exercise to figure out how irritable your symptoms are, how much can you do, and if you're centralizing or peripheralizing, which tells you how healthy is the nerve in that moment. And so listen to your body and use those rules of thumb as you're doing the exercises on your own or whether you're following the program in my book. Use those rules to help you recover faster and smarter so you can get better and stay better. Okay, so we just went over the rules that you should be following when you're trying to exercise to figure out how irritable your symptoms are or your nerve is and how much can you push and pull. That's very important, and that will be following you during your entire recovery for sciatica, and that you want to make sure that you're not making things worse. And that's how you know, is you know the irritability of it and how much can you push and pull. Now we're going to move into the fourth mistake, which was being unaware that you need to stretch your nerve. And that when I treat people with sciatica, they've done all of the stretches for their back, they've done all the stretches for their joints and muscles, they've done the exercises. What they miss is of stretching the nerve. And a lot of people, I would say almost 99% of people that I start working with aren't aware that you need to stretch the nerve. And this is the missing link, in that when we bend over and when we move, your nerves are actually moving and being stretched. We know this through cadaver studies, is that when you bend over, your sciatic nerve and the nerves in your back are being pulled. Now, they don't stretch like a rubber band per se. It's more of like when you pull a wet towel, and that the length of it doesn't change, but the fluid around it does. And that's what controls your symptoms. Because the reason why you're having sciatica and pain is because of the inflammation around the nerve. And the only way you get that inflammation out is through movement. And so people forget to train their nerves. So what I want to do is go over how do you tell if you actually have some of that nerve tightness and what stretch you need to do to make it feel better. So this is the game changer. We know that stretching and exercise is good for treatment of sciatica, but it's about when and how much, and we went over that with the peripheralization and that type of thing. But once you start learning your symptoms, people forget to stretch their nerve. They're doing hamstring stretches, whether bringing the leg out and bending over, they're doing glute stretches and pigeon poses and that type of thing, and lower back stretches, but they're not stretching their nerve. So I want to go over my very favorite way to stretch your muscles and your nerves. So what you're going to do is you're going to hold on to something sturdy. I typically recommend like a countertop, stand next to it. We're gonna do leg swings here. So just like the good old track days, we're gonna focus on a pendulum of this leg. Now, as we go back and forth, it's loosening up our hip. It's stretching the hamstrings when we go in front and the quads and back. Remember, the sciatic nerve goes into the hamstring and down the back of the leg. So when our leg goes up front, it's stretching the muscles. So what I do here to get the muscle and the nerve is that you're going to do your normal leg swing, and you're going to go as far back and as far forward as you can. And then what you're going to do is you're going to think about pulling your toes back at the very top of that range there. So pull your toes back when it goes in front of you, pull your toes back when it goes in front of you, pull the toes back, and what you will notice is that you're going to feel something tug into your calf in the back of your leg. This is the nerve glide. And the reason why I like doing it in this leg swing position here is that it's very applicable. It's easy to do. You can do anytime as much as you want during the day. But you have to stretch the muscle, which is the hamstring, and you must stretch the nerve. And so as the leg goes in front, we pull the toes back. Legs in front, pull the toes back. Legs in front, pull the toes back. And what that may do is reduce the range, but that's okay. As long as you're staying tall and pulling those toes back, you're pulling that nerve. And I promise you, if you test your ability to bend over, then do the nerve glides, and then retest your ability to bend over, not only will it feel better, but you'll go further. I promise you. I see it so many times. Let me know if that doesn't happen to you. But if it does, I also want to hear that. Be like, yo, Michael, I didn't think that was going to help, but it actually did. So when you start to include neural dynamics or moving the nerve into the recovery of your sciatica, not only will you get better, but you will stay better. I've had people with sciatica years ago still doing the nerve glides and the leg swings because it's important and it nourishes the nerve and it's easy to do. So think about leg swings without pulling the toes back and leg swings with pulling the toes back, and work on both of those. Now you'll see on my website that I have workouts established and built for people with sciatica, with stenosis, or disc issues. And almost all of those include, actually not almost, every single one of those include moving the nerve and nourishing the nerve. And once you combine your ability to learn your symptoms, know when to push and pull, and then also nourish the nerve, ooh, things get a lot better. You have to move the nerve, do not forget about it, and try those leg swings and let me know how they go. So we just went over how to tell if you have a sticky nerve or a nerve that needs to be moved, and how to test it. And before that, we went over how to exercise and use movement in a way that we know is safe by knowing if we centralize or peripheralize, or by knowing our irritability levels. And now the last thing and the fifth mistake that I want to talk about is that people are afraid of movement. You should not be afraid of movement because we know all of the things that we knew that we just covered. The fifth mistake is that people just don't move enough. They don't nourish the nerve and nourish their body in a way that is appropriate. Now, it's about doing the right stuff at the right time. And that's why I go over in my book a very detailed, laid out explanation of week by week by week what to do, because it's important that we do the right things at the right time, and we know our irritability levels along the way. So we know that we're not doing any damage. We're encouraging this area to move, and we're stretching the nerve, and we're mobilizing every single area, and we're strengthening the area as long as we go. So that's why with the Spark program, and when I treat people with sciatica, we're working on strengthening, we're working on pain relief measures, we're activating the nerve, we're regaining the mobility, and we're keeping movement at the foundation. And what people don't understand is that they need to move. Now, what you do and how you do it is important, which is why you sometimes need to team up with a professional or really dive into your own body and do a good 15,000 foot view of how your body responds to movement and exercise. But it is absolutely important to move. If we use movement at the foundation of our recovery, we're going to win. Motion is lotion for the nerves. Motion is lotion for the body. If we focus on movement, you will get better, but it's about the right stuff at the right time. You gotta know what you're working with. You've gotta know, do you truly have sciatica? You've gotta know how to move the nerve. You've gotta know, are your symptoms centralizing or peripheralizing, or how much can you do before you're sore? And then also put in your brain that movement has to be at the foundation of recovery. If you keep those 5 things in mind, you will get better. I absolutely promise you will get better. But sometimes it takes using resources like this, or my PDFs on my website that go over very specific workouts, or using my book or other YouTube videos I have. But utilize those resources to help you recover from sciatica, whether it be from a disc herniation or stenosis. These rules hold true for all of those things. So I hope you guys found something useful from this video today, and that you know that you're going to get better and gives you some confidence. But if you have any questions, please feel free to leave those questions underneath the description of the video. I will get back to them. It's important to get those questions answered. But as always, guys, I appreciate you watching. Keep moving and take care of yourself.